people who underreacted, and I do think there is some legitimacy in how fatal this can be, and we do need to be proactive and do things. So, as you know, this virus is mutating so much that the things we used to think last month or 2 weeks ago, they're evolving and they are changing all the time. So, which makes it very difficult. And most of the people who we're testing and we have research on are in the hospital setting. They're not clinically the people who are quarantined at home. So it would be great to be able to study both. But I know I did a post a while back telling you guys to take all these things that, hi Heather, that are good for the immune system. And the reason why I really wanted to come on today is because, as you know, as someone who practices natural medicine and conventional medicine, if it's glitchy, guys, the people on Instagram, I'm going to be posting this again. I'm recording it for Facebook, and I'm going to be putting it on YouTube. So yeah, sorry, I don't know why the connection is slow. Maybe because I'm so anti-EMF and I've like done all these things to block the modem from working well. But my point today is you'll see posts from many natural doctors or even medical doctors, it doesn't really matter, I don't think who they are, telling you to take things to boost your immune system. And I just want to make you guys aware of something called a cytokine. Cytokines are sort of your body's immune response. And what we don't want, and we've seen in the past with viruses like this, is there was one where a group of 18 to 25-year-olds were the most killed. And the theory was that these people were having cytokine storms. And so some of the things like elderberries, all these natural antivirals that we have, we really don't know how it's going to react to this strain of coronavirus. So I'm very cautious. Obviously, at the university, we practice evidence-based medicine, so we need to know, and there isn't enough evidence. So I've been reading all the 2020 articles that are coming up now, but looking in the past, what's really interesting, as I mentioned this morning, that resveratrol, which comes from red grapes, is a major antioxidant, tons of research for heart disease, and curcumin, so from turmeric, has the most research I found. And everything else could actually be harmful, but we don't know. So I hate saying that, but we really don't know. So the best thing we can do is not just to go start taking all these things and change your natural immunity. What you can do is contact your doctor and make sure that you are dealing with whatever conditions that you already have. So for example, if you tend to be asthmatic, if you tend to have allergies, if you tend to be really fatigued and have like no cortisol production all day, if you tend to have hypertension, if you tend to be pre-diabetic and have diabetes, and if you're obese, or morbidly obese, any of these things, this is where you actually want to do the work right now at home to fix that as much as you can, because the healthier you can be now with diet, exercise, and social distancing yourself, the better outcome. But taking antivirals, taking even elderberries, we really don't know. So as a doctor, I can't tell you to take that, because if it increases your cytokine and God forbid something happens, you could have a cytokine storm, and we just don't know how that's going to react. Another one that I keep hearing, even colleagues of mine recommending, is silver. And the CDC has actually banned silver, and it's on the sort of fraudulent list of things to not use. IV silver, I hear people doing all kinds of IV drips for this. I honestly wouldn't. I wouldn't go there at all. You have no idea what you're messing with. And then also being outside, exposing yourself, getting an IV isn't a good idea either. Glutathione, I get asked about. I wouldn't right now, because we just don't know. I would get antioxidants from food. The two of the safest things are vitamin C and vitamin D. So those you can take. Generally, everyone can take 2,000 IUs of D a day, if not 5,000. I'm usually low, so I'm doing 50,000 IUs once a week. Um, and sleep and all the things that you've already heard of, that is the best thing you can do. And yeah, social distancing. So unfortunately, for example, for us, it's Persian New Year next year. And, we were supposed to have a big gathering at my mother's house, and my grandmother was supposed to be there. And I felt really bad. But today I actually canceled it. And I said, we're not leaving the house. We're not seeing the cousins. We're just doing our own thing and sticking together at home. So I'm kind of self quarantining because I still have to go and see my patients, and I'm not going to add more risk of being exposed. And it's not that I'm worried about anything happening to me or my kids, because as you know, kids are carriers. They don't usually die from this, but then they can transmit it to someone else who's weak. Um, I've been seeing patients all day from home, and what I'm really trying to do is manage their stress levels, because if your cortisol is high, and I know it's very difficult to stay positive and not worry, but for my very anxious patients, I've even done some cortisol tests this week, like some of them are through the roof high, and that really weakens your immunity. So anything you can do to laugh, to be happy, to be in the moment as much as you can, to bring that cortisol down, and to not be hi Drew, to not be in that sympathetic dominant mode. That's very good for you. And the other one I like that also shows increase in white blood cell count is that's pretty safe. It's not going to actually increase and predispose you to cytokine storms. Constitutional hydrotherapy. So this has been around for years. This is when you've seen people jump in hot water and then go into cold, hot, cold. Doing this can really help increase circulation and can increase your white blood count. So when you take a shower, just leave it on hot and then do 30-second cold, 3-minute hot, 30-second cold, 3 times, and always end in cold. So super simple to do. Cold plunges, if you're doing that, that's good. Good question. Flourish with Chelsea is asking me about Echinacea. Actually, so I'm guilty of recommending Echinacea a couple of months ago, and the evidence shows that no, anything that increases interleukin 6, and Echinacea does that, is actually contraindicated with this virus. So I'm going to advise everyone, if you are taking Echinacea, in my opinion, and this isn't just my opinion, so just so you know, from the university, we have to follow the guidelines of occupational health. So when a patient comes in, we actually have to call in and look at what the research has shown and follow the university. And just so you guys know, University of California, Irvine, I'm so proud to be working there, because we have 3 places where you can go and get testing done currently. And there's been research on the same antiviral drug that was used for, why am I blanking? In the past, remdesivir, which is an antiviral that's looking really promising. So they're actually going around right now and doing a double-blind placebo-controlled trial on that, on the current patients that we have. So, and don't message me. I've had people messaging me asking me if I can write a script for this antiviral. Unfortunately, and you can understand and be compassionate, this is just reserved right now for those who actually have the virus, and they're using it for therapy only. So it's actually not an FDA approved drug for Corona-19, but it's actually looking very promising. So that's good news. So that's the chloroquine, phosphates, and remdesivir. And as I said, anything else like black seed oil, echinacea, all these things, which I absolutely love. And up until now, I recommend them all the time to my patients. I just wouldn't do that right now. There isn't enough evidence. This virus is mutating so quickly that if we had said 3 weeks ago, this is actually safe, it might not be right now, right? So I also encourage people, who are in this field or natural medicine or anyone, not to make this such a joke. I keep seeing like these TikTok videos and people really dismissing this, saying it's a conspiracy theory and that humans made this and it leaked out of this and that. No human being could make such a virus this powerful that could spread this quickly and kill so many people. So, I mean, I had patients today who were telling me they can't visit their parents. They're in the nursing homes, and of course, they're all on lockdowns. So my heart just goes out to the people who don't have a family, who are alone and now can't really go out and can't see anyone. So hopefully they have internet access and they can access doctors from there or access family and friends and still not feel socially isolated or discriminated against. Um, yeah, so as I mentioned, Echinacea, I would not recommend using Echinacea right now. The research we have are on different viruses, early stages, but Astragalus, most of the mushrooms, as I said in my post today, I looked them all up and they all increase interleukin-6 and can cause cytokine storms. So I'm actually recommending a lot of my patients I see adding all these mushrooms to their coffee every morning. And yes, I love all of them, but the only one that I found could be safe and good is Ganoderma. Vitamin C, totally. So vitamin C, you will rarely ever find a contraindication. Ascorbate, so when I say natural vitamin C, I'm talking about the form that is naturally found in food, fruits and vegetables, not ascorbic acid. And you can take that to bowel tolerance. So you can take 1 gram. Yes, I will save this and post it, guys. Yes, I will. I would say 1 gram every 2 hours, 3 hours if you tend to be weak. So my weakness is not my lungs. I don't think I've ever had pneumonia or bronchitis. That's just not where my disposition for illness is. But if your disposition is to have weak lungs, so if you have had any kind of lung issues, even up until 2 or 3 years ago, a pneumonia, bronchitis, definitely if you have recurrent issues in the lung or the respiratory system, all the way from your nose to the back of your throat, all the way down to the lungs, and cardiac. So any heart disease, of course, you're at more risk. And I would be very careful if I were you going out shopping, getting groceries at the store, and really socially isolating yourself. For the moms and dads who have kids who have those issues, I would definitely keep them home. And I've kept my kids at home and I'm keeping them at home. Their school actually is canceled, so I'm really happy that they did that. But I would have kept them home anyways. So until this is totally over, yeah, so anyone, of course, cancer, chemo, if you're on prednisone, if you're on any kind of immunosuppressive medication for an autoimmune disease, anything like that, you're at risk, because now not only is your immune system not working when the virus evades, often it affects the lungs and it can cause even septic shock we're seeing. And it can, especially in the weak people and the immune deficient people, it can be very quick. And the thing with this is there's no runny nose, really. You can have symptoms for 14 days, although the mean is around 5. You can have symptoms for 14 days and not know. So you could be very contagious and not have had a fever yet, not have a sore throat, just barely have a cough. So hi, Michelle. Hi, Goli. And yeah, so that's what's hard, is it's not a quick onset. So we're open. We're a huge part of the university, helping everyone's immune system. Again, I want to rephrase and not say boosting the immune system. We don't necessarily want to boost the immune system. We want immune modulation with herbs and things that have been shown to help coronavirus. Now, coronavirus has been around for a long time. So many of the tests, I have patients, they're freaking out. They're like, Dr. Demeri, this showed that I had corona. And I'm like, no, that's an old strain. That's not this strain. But this strain is very different. And it's, as I said, it's mutating and changing. So I will keep going. If you guys like this, I'm going to, I know not everyone can afford to pay for visits with me online. So what I want to do is answer everyone's questions. So I'm going to have times that I'm going to post where I will just be on Zoom and you guys can have the link and ask any questions. And I'm here to even get specific with some of your symptoms. If you're not sure, ask me, ask a doctor. And what we are supposed to do is call occupational health on your behalf. So you can't actually call them and ask, based on your symptoms if you should go to the hospital, go to the ICU and get a swab. And as you know, here the issue is shortage of all these swabs and masks, and that's another big issue, which is why I'm so happy that they're closing the schools and really trying to stop this. Because if we go down, if the healthcare system crashes, there's no beds, you can imagine, and the doctors get infected, and we can't support all the people coming in, then we have a huge crisis. So that's why I'm really, really encouraging people to stay home, and not because this is over exaggeration or panic, but because we have to, like, we really owe it to everyone, the whole world, to stop this and to help the healthcare providers and to help the, ICU nurses and the doctors, and make sure that they can really help the people who are sick. Please mention which herbs to take. Structural silver. So no silver, I'm saying no silver. If you actually go onto the CDC, it's one of the ones they're saying not to use. Obviously, with everything else, I love silver. As you know, before penicillin, that was our natural antibiotic. It does kill viruses and fungi. But with this particular strain, I'm telling you not to use it. Quicksilver's liposomal C, okay. Yes, that one is okay. Yeah, the New York schools are all, yeah. So I mentioned elderberry, I'll say it again. No elderberry, no echinacea, no astragalus. And like you guys saw, I've gotten over 200 research articles that I'm reading, and many of them are from China, Taiwan, all the places where it's amazing how quickly they're trying to write these articles. So some of them aren't the best quality papers, because I can see like they just had to rush, and that's amazing. I'm so happy that at least they're getting published and we can have access to this. But as I said, every 24 hours, we're hearing some new things. Since yesterday to today, not a lot has changed. I just wanted to give you guys the update on the antiviral that is being used. Zinc, yes. So as I said today, zinc does have good evidence for its use. So I am big on zinc. I have almost run out of zinc lozenges. So what I'm doing, because you need more than 5 milligrams, which is typically found at your local health food store. So I'm actually making my own with 15 milligrams, 30 milligrams that I have as a supplement. And it's really the back of the throat. So it stops the viral replication. And so I think in the research, they had patients lying on their back, and to make sure it goes all the way to the back. Because as you know, when we touch our face, this is how it can transmit here, and it goes in. But first we thought that this was airborne, and it is. So the most contagious could be just you breathing. But now we're also seeing this is way worse than influenza and the flu, because I think MIT did research looking at metal, looking at fabric, and plastic and metal is where it lasts the longest. And it can last for 3 to 4 days, whereas, the influenza could be hours. So that's why this is also an issue. So doorknobs, elevators, like I said, stay home, and then you can avoid touching things. But washing your hands, like, now is a time where the people who have OCD, this is like where you get to thrive. This is where, like, if I've ever made fun of a friend or a family member, not that I make fun of people, but if I've ever been like rolling my eyes saying like, oh my God, like, relax, it's just a cold, it's just a flu. This is not the time to do that. I hope I'm totally wrong about all this. And I hope that we are all over exaggerating. Obviously, we don't want to be panicking. And I know some of us have, some of my patients today from Connecticut, Mississippi, I had people from all over the states, and even Brazil, like they have to go out and get groceries. I don't know, but wear a mask, but just know that the research shows that doesn't do much. It's only good when like everyone's wearing an N95 mask, which we have a shortage on, so we can't really use that. But sometimes the issue with a mask is that you think you're protected, so you end up touching things and then touching your eyes and your face, and there's some research showing that it can actually increase your risk of getting infection. So when you come to my clinic, for example, as I said today, you're sitting very far from me, at least 6 to 9 feet. And everyone wears a mask. We wear a mask. We screen people with 3 times. No one is allowed to come in if they have any respiratory symptoms, contact me or someone else, and you definitely, that's one of the big red flags. Obviously a fever, a cough, but anything that goes into the lungs. What about grocery items? I know. So I'm ordering from Whole Foods. I'm using Prime now here in California. I literally have not gotten groceries for 3 weeks now. So I'm fortunate that way that I have that. But if you absolutely have to, obviously, it's really important that you get fresh fruits and vegetables at this time, but it's also okay. And I wouldn't risk going into a very busy grocery store. You know, I had friends yesterday saying it was 45 minutes for them to, you know, check out with all these people. That's not what you want to be doing. You want to be very careful. Iodine. Iodine is interesting. I love it for the immune system. However, obviously it's not going to kill this virus. But if you tend to be iodine deficient, like I said, what you want to do is address your underlying conditions. Now, you might not be obese, you might not be hypertensive, you might not have diabetes, you might not be over 60, but let's say you have health issues. That's what you want to address with your doctor right now. Ganoderma mushrooms, zinc, vitamin C, and vitamin D. Niacin. Niacin is tricky. I don't recommend it unless I've seen your liver enzymes, because it can actually damage the liver, and it depends on the dosage. Any brand for the zinc lozenges? No, there's like such a major shortage right now. So as I said, at the clinic, we were having issues finding zinc lozenges for our patients. And most of the ones out there are 5 milligrams, which isn't really enough. What about thorns, NAC? So N-acetylcysteine, which converts to glutathione, but also it needs the right bacteria in the gut for it to work. So I'm going to say, sure, if you want to. I don't see it being harmful, but there's no evidence against this virus for it to work. I know oregano oil is sort of like the magic all since I think we were little. You know, this was the thing, the natural sort of antiviral, antibiotic. I haven't seen that in the research. I still have over 1,000 papers to go through. So I wouldn't, I'm not going to be using essential oils. Again, it's not my expertise, and please take all of this with a grain of salt. I'm just communicating with you what I'm learning from reading papers, and I'm pretty good as a scientist gathering information also from the town halls and the mandatory visits that we have to have at the university. All the doctors do. Frankincense oil, I don't think so. No, none of these things are going to do it. So I wouldn't focus so much on that. I would focus on, like, for example, I don't know if you can see I'm red. I just worked out in the gym and I'm all sweaty. So what am I going to do for exercise? You know, like I had all these habits in place for yoga and exercise and teaching Zumba. So what am I going to do? How's that going to shift? So all I'm doing is positively trying to stay myself. I'm not a very anxious person to begin with, and I'm sorry to all the friends who reached out to me freaking out about this a while ago, and I was probably dismissive and said, it's not a big deal, calm down, it's just a virus, you know, just boost your immune system. Whereas now, no, like as of last month, this is a bigger deal. And so try to really focus on, you know, making soups and adding some Ganoderma mushrooms, getting broths and getting lots of fruits and vegetables, you know, with that, so it lasts. I've also gotten a lot of canned food. I've also gotten, non-perishable items, because you just never know. Like, you just never know. What if, like, we have to stay in for 3 or 6 months and, like, everything does close? I also have cash in the house. I keep filling up, not keep, but as soon as my tank goes down to half, I do fill up the gas. Liposomal vitamin C, yes. So with the liposomal, that means that it's in a form that can actually pass the gut and get absorbed. So that's what the curcumin and the resveratrol was found. You want to make sure you're getting a liposomal resveratrol and a liposomal curcumin. If any of you guys actually need specific recommendations and you're my patient, you can just go to my aimforwomen.com, click on dispensary, and you'll see many of these things in the full script. If you're not my patient legally, I cannot recommend a specific product to you, but I can tell you what I recommend to my patients, and then it's your choice to purchase it or not. But obviously check with your doctor first. But just so you know, if your doctor is real and up to date, their answer to many of these things should be, we don't know. Okay, so if anyone is making crazy claims that this is going to kill it and this is it, or take elderberries or take this, they haven't done the research and they actually don't know. So I don't want that information to keep going around. So that's why I came on live. I don't mean to be a party pooper, but just take the basic things that we know work and really try to sleep and hydrate and exercise at home and breathe, meditate. Remember, you're a soul having a human experience, and viruses need hosts. They need weak people. They need to live off and take your oxygen from your iron too. So the other thing is, many of you, I've actually asked you to stop your iron. So if you're anemic and you were told to take iron, if you're my patient, you've probably seen that I've actually told you not to take iron right now, because that can feed the wrong guys, right? So we have something called anemia of chronic disease. There's a reason why your body actually gets rid of iron temporarily so that it doesn't feed the wrong guys. Hold on one second. Okay, so sorry, I think it just cut out on Instagram, so let me repeat that quickly. So if you're on iron, I would say stop taking iron or talk to your doctor and see if that's appropriate, because iron can feed the viruses the oxygen in there, and you want to support mitochondria. So as you know, I have Epstein-Barr virus. I don't have any other viruses that I know of, no herpes or things like that. But if you have herpes 1, any of the other viruses, you know, and you have had the flu, and you tend to get sick and you have low white blood count, or you had mono and it really wiped you out, you want to also maybe take CoQ10 to help support your mitochondrial function. The reason why, if you've had, you know, viruses, as you know, like mono, what happens is you get really tired. And you get tired because the mitochondria gets damaged and it can't make ATP. So I'm going to say it should be safe. Again, I'm going to go through the rest of the articles and see if that has any research on it. But I don't think it's a contraindication to take CoQ10 if you're like me and you have some mitochondrial dysfunction or fatigue, and you have lots of viruses that you know from past that are dormant. So know that the body is more intelligent than anyone else will tell you. We are a bunch of fungi and bacteria and viruses that's already in you, living, trying to live in harmony. So that's why I'm saying don't go out there and all of a sudden start taking all these supplements, because you might actually interrupt your own immune system that had it together. And now this new virus, well, if it comes in, might come in, and then these guys are like, whoa, we're having a party, like we all changed, you know. And so you just don't want to do that. You don't want to mess with it. We don't know what it's going to do. Sure, I will try to figure out how to put this on YouTube. I will put it on under my YouTube. CoQ10, I'm on it for blood pressure. Great. If you're on blood pressure medication, continue taking your blood pressure medication. Please don't skip it. You want that to be managed. You don't want anything all of a sudden now to change. If you have hypertension, get it treated by me, by someone else, especially if you have to take a medication right now just to get that managed. That's important. You don't want to have any of those underlying issues and not have it treated. All right, guys, I'm going to check out for now. I will be homeschooling some of the days next week, so wish me luck. But try to stay calm and positive, and I will keep you updated every time I hear something that I think is newsworthy, because I think there's so much saturation of information right now. The reason I've kept quiet is because I just don't want to overwhelm everyone with all this knowledge. But if there's something in terms of what can you do, I will update you, and what shouldn't you do, I will update you. I'm not going to go into the science. I know many of you are healthcare providers that follow me on what this actually does in the lungs and what it blocks and what receptor. I mean, I could geek out on that stuff, and that's what I'm reading, but I don't think that will benefit any of you guys. It'll just confuse you and put you to sleep. All right. Bye, guys.